Hi, everyone, and thank you for joining us. I'm Katie Sacra, GFPD Director of Operations and Family Programs, and I'm also mom to an adult living with PBD-ZSD, and I'll be moderating today's webinar, Supporting Families of Children with Complex Healthcare Needs and Grief Across the Lifespan. And joining us today, who's going to be presenting, we have Jana Villamay, and we also have Jennifer Knox and Megan Cody. And I'm excited for all of you to hear from them. They are amazing women who I know several of our families have already met. And we will be doing Q&A at the end. So if you want to share your questions in the chat box, I'll be moderating that. And we also, just below the webinar player window, you can submit questions. They can come through anonymously if you're a little uncomfortable asking questions. We're happy to ask them for you and get some answers. So go ahead throughout the webinar as questions may pop up, share them, and I'll make sure that we ask those towards the end. And I'm going to go ahead and turn it over to Megan Cody.
Hello, everyone. As Katie just so kindly introduced us, my name is Megan Cody, and I'm the Technical Assistance Coordinator at the National Center on Deaf Blindness, also known as NCDB. And as she said, I'm pleased to be joined today by my fellow colleague at NCDB, Jana Villamay, who's the Family Engagement Initiative lead, as well as Jen Knox, a remarkable parent from the great state of North Carolina. Today, we'll be sharing a bit about what we've learned through our work in supporting families in grief across the lifespan. Next slide. First and foremost, we'd like to thank the families and supportive community that embody this work and for the invitation to be with you all today. We acknowledge that this is not an easy topic, and we're grateful for you coming to learn and listen with us today. Next slide. First, I'm going to provide you with a very fast overview of our work within the Deafblind Technical Assistance Network and what it's taught us about grief. Then I'll pass it over to Jana, who will share a bit about what grief is and the impact of grief on families. And finally, Jen will share her parent perspective of her lived experience with grief. Really, Jen's the reason to be here today because we learn best by listening and sharing with families, right? So let me be brief in providing you context for why we were asked to share with you all today. Next slide. The National Center on Deaf Blindness is a federally funded grant through the United States Department of Education that works with state deafblind projects and other partners like GFPD to improve educational results and quality of life for children who are deafblind and their families. One of the things we do is maintain the national deafblind child count. From 2010 to 2018, an average of 89 children ages birth through 21 on the national deafblind child count died. In 2019, an average of 112 died. So in 2017, I convened a group of parents whose children had died and asked them what support they wish existed and how we as a network could best support their family. As a result, family members were trained in peer-to-peer grief support, and we kicked off our first ever virtual grief group in 2017. We've been offering true groups since, and any family member of an individual with deafblindness who has died is welcome to join. We just started our 7th group this fall, and thus far have supported approximately 30 families, and have also worked with GFPD to get their grief group up and going. I also had the honor of providing bereavement support at the last 2 GFPD conferences. So here's what we've learned that's unique about grief from the participants that we've supported thus far. The intimate caregiving required creates a large void after the death of their child. Their sense of role or identity has forever changed. They experience secondary losses of providers and the community that surround them once their child dies. The unexpected reaction from family and community at the time of death, concern about supporting surviving siblings, and impact on relationship with individuals who assisted in the care of their child. I could spend the whole day unpacking each of these for you, but let me summarize it with a quote from one of our bereaved families. The best advice I received was the only way to get through grief is by grieving. I didn't know on the day my child died that the joy and pain could live together so seamlessly in the remembrances of him, and that I would welcome the pain if they were a package deal. So with those words of wisdom, I'm going to pass the mic to my colleague Jana Villamay to share with you a bit about grief and how it can manifest in our lives.
Thank you, Megan. Welcome, everyone. And I would first like to begin with the grounding of what grief is, where we'll start. And I'd also like to acknowledge that the word grief can evoke a myriad of emotions, thoughts, and feelings from each of us, depending on our culture, how we grew up, our unique relationships, and our individual vulnerabilities, along with our strengths. This is essentially a part of our unique worldview of what we assume life will be like, and then it doesn't happen, and we're continually reminded of it as we navigate this change in our life into a new world we're unfamiliar with, and are challenged to find others who are familiar with it and okay to talk about it. I'll be focusing on grief over the lifespan of families and their child. Jen Knox will be sharing her unique story of her child who lived and died, in hopes that it provides some meaning to you. This is courageous stuff on Jen's part and your openness to listen and learn. I would also hope you all in the space that you're currently in would feel safe enough to feel the emotions that you have or have had in the past, and can then move through them to where you are today, in the present, at this webinar, supported and loved. Second, I think we can all agree that losing a child is a grief that, while it happens, it's one that creates more pain and gut-wrenching questions about the order of life. It's challenging. I'll be focusing on our families with children with complex care needs have compounding. It could begin with diagnosis, but the complexity of living in the society we do and the systems that were created by people that may not have had any lived experiences creates hardships for the whole family, compounding the loss. And again, having conflicting feelings caused by change in what is familiar, which is why I want to share this definition. It's a loss of any kind, unique to the individual experiencing it. And the greater the loss to the individual, the more complex the pain and grief journey is. Acknowledging and processing the grief is key. One can't ignore it. It happens, but how it happens varies with each individual. The loss is not necessarily due to death, but nonetheless, it is a loss. This journey of grief is impossible to refuse, but it can lead to very different. Like any crisis, grief can be an up and down journey toward meaning making if we acknowledge the grief and the people around us, our support systems, and receiving the acknowledgement of those hurting that view it as a normal part of grieving, which is what we have to live with and acknowledge in order to come out of it with new meaning and purpose. I wanted to share a visual that I'm breaking into parts to explain to you. This visual helps guide me as I work with families and serves as a reminder to me about the grief that our families have as we support them. My work is about engaging families to be informed about the world of deafblindness, its impact on how their child learns, and how they can best advocate for their child. In this visual, the family is indicated by a triangle in the center, the concept of providing a family-centered approach. And this triangle takes into consideration all members of the family, knowing that if a change happens to one member of the family, it impacts all members. There are also 3 circles that overlay and intersect with each other that indicates the family's level of possible engagement that I use to determine types of resources and opportunities to provide for them. These 3 circles indicate a family's capacity to be engaged at an individual level, at a community level, and possibly at a state or national level. In its simplicity, most agencies and those supporting families might leave it to that. But if we take a deeper look at who each family is and what it takes to be, quote, ready to learn and engage at these levels, being family-centered, is complex. But again, bear with me. For the family to be in a place of being able and motivated to learn, seek our resources, and be engaged, it's important for us who work with families to also be reminded of the support systems that surround the family, thinking about what it takes to successfully navigate these systems, and knowing the stronger the supports, the stronger the family. You can see the ongoing critical systems that supports the family. This is true for all families: the legal system, financial system, social work, social network, the medical system, and the educational system, and all the laws around those. These systems of support are a part of all families, but with our families, the diverse and complex level of knowledge and expertise to successfully interact with them is heightened significantly and compounds the stress, which can be secondary losses the family suffers as they lead their family. I think of the often unspoken financial changes in most families. Our educational system and the medical system, while well-meaning, assess the child based on what the child cannot do and where they should be compared to others. Again, more triggers of loss for the family in their isolation from the norm. I want to highlight the social network surrounding families. This provides us with the needed support outside the formal agency, and is yet in our families' lives, so many of these relationships, extended family, friends, church family, very often dwindle or certainly change, which sadly is another loss, right? And included in the social network is each family's cultural beliefs and spiritual beliefs. All of these play such an important part that impact the family and the child. As I engage with the family, I'm thinking about these systems and in many ways that control the direction the parent can or cannot go. I think about how a particular family is tackling these systems and their capacity to do so. Add to this the impact of the more vulnerable, marginalized populations, the cultural and linguistic diversity of the family, and the challenges of access to these systems. It's complex, right? I'm also taking into account where the families are in the circle around the major systems, which is the adult life stages of the parents. And as the up and down arrows that you can see within those life stages, this serves as a reminder to me of the ongoing and or intermittent grief our parents have as they move through the child's and the parent's life. The adult life stages depict our growth and development, just like they're developmental stages of a child. Lived experiences move us in general patterns of maturing, carrying with it still a level of grief. The grief process is lifelong, with associated losses that come with it. And over the lifespan, the good part is the growth that comes from the process in the majority of families brings great joy in varying degrees, and the family, depending on those life experiences and who they've connected with, felt supported, inspired by, and listened from and learned from others in their support systems. When you listen to Jen's story, I ask you to keep thinking about the ongoing changes in the family's lives who have a child with complex needs, from not having the child they had anticipated, the trauma of the pileup of diagnoses. And yet, Jen grew to realize or reframe their life, getting to know their child, making routines that brought joy to Charlie and to the family, and now finding more ongoing meaning and purpose than they could have ever imagined by having their amazing child. The grief journey varies between individuals and throughout the lifespan will fluctuate. Once again, the loss, the associated losses experienced, the journey and the process of how one grieves depends on the individual parent and individual members of the family. Jen's story is not everyone's story, but the grief and associated feelings of shock, guilt, shame, isolation, and indescribable pain is universal and normal. Yet how that looks will be different for each family. This too can be complicated. Our grief experts have also helped us understand that we may process our grief differently. There is no right way to go through grief. And given the individual, it may be processed intuitively, which is talking about it and talking about one's feelings, or by doing, from retiling one's floor that Jen mentioned, to creating a foundation in memory of their child. And we need to factor in it, the trauma and stress when sitting with the families. The crisis they experienced in having a child with complex needs is not a single event in having a starting point and an ending point. There's a cumulative loss and trauma that typically exist, and we can see it in the heightened anxiety of our parents in many cases. Naming the grief, this also helps us process it. So to our professionals, extended family, and families supporting other families, I'm not suggesting you, as one supporting a family, start your relationship with your families by getting them to talk about their grief. Rather, empathetically supporting the families where they are, listening and allowing them to share their history of their child at their pace, and acknowledging that grief you may hear or see in their behavior by validating their feelings and their story in a non-judgmental approach. Think of yourself and or the families you love and support. As I go over the type of grief that all or one or two types may apply as the child lives or following the death of the child. And that is anticipatory grief. Grieving not for just what has already happened, but what is likely to happen or not happen in the future. Families may experience strong anxiety as a result of this. What will happen to their child after they die or are no longer to be able to care for? Complicated grief. This is loss that is unanticipated. It's traumatic, and it just wasn't supposed to happen. One can't make any sense out of it. The grief that has no resolution. And given that society does not know how to support others in their grief, it is suppressed for fear of being judged, and it is likely to seek help for fear of being further stigmatized. And then there's ambiguous grief when the losses are uncertain, episodic or recurring grief. So where you're enjoying the relief of not being in a crisis mode, and then back to another crisis that sets one back. And what can happen is just another heightened level of anxiety, just awaiting for the next episode, unable to enjoy the moments. And lastly, there's disenfranchised grief. These are losses that are not recognized nor understood by society, the world at large, the community and social network of church, extended family, friends, cultural beliefs, and values. And since society doesn't recognize it, it's also conflicting for our families to be able to identify with what they're feeling as well. Consequently, if society doesn't know how to acknowledge it, there's little, if any, practical and emotional assistance. I will tell you, GFPD, Megan and I, and Jen, we're not immune to what society has taught us well. It's too uncomfortable and personal. Yet the conversation needs to happen in order to acknowledge its existence and truths, for all to come out of a more whole life, especially since we want the families to be able to successfully engage with us. And most importantly, so that in the end, the families are stronger, healthier, and able to better care and lead for their family and their child. So, for professionals, caregivers, extended family, others, what can you do with this information on the grief of our family's experience? For the physical and emotional signs which may show up intermittently, take time, watch for, be curious and open with the family. And with a trusting relationship, affirm the family, validating their feelings and what they can acknowledge. You can't fix it, but you can be open to listening and taking time. Also, keep in mind the resilience the family has acquired. While you are living with grief over all that we have talked about today, the fact is our families keep marching with an ability to cope, just as you will see with Jen's story, with the fluctuating trauma and loss, the back and forth from orienting themselves as needed from the loss and what it means to be restored in the gift their child brings, and how you are making meaning and purpose for yourselves and for others in the community and leading the family. We want all of our families connected with other families in a safe place to tell their story without judgment, to process where they've been, where they are now, and what their vision is for the future. It is powerful. Reframing one's story in this way makes it more livable, but still true, moving to making meaning and purpose, like we've talked about. And your GFPD family wants to help and offers other ways to connect. And I'd be remiss if I didn't add the last bullet of the concept of mindful self-compassion, the need for families to stop, breathe, and be in the present moment for themselves and for their family. Caring for themselves like they care for their families and others around them that are hurting. I want to add that the hard work of leading one's family in a world that assumes life is like the majority of families without a child with special needs conditions one to step back and stay in isolation. But once a family is connected with other families who can feel safe to share their life and their story, good things happen. Through this sharing, families are retelling their stories in a way that's more livable. So their grief becomes acknowledged in a way that allows them to find that specific meaning and purpose in their life. So takeaways. We hope we've added some depth and understanding about the issue of grief for our families and complex needs. Our goal is to increase your awareness and understanding that loss plays a role in how families are able to engage with you, others. Having this understanding will positively change the framework you use to engage and respond to families. Like all of us who've experienced grief, we want to trust who we work with, feel we are on an equal playing field in our partnership in making change for children, and to be heard and understand. So here's what we'd like to take away. Make no assumptions about another person's grief and loss. Be present and listen with empathetic care, especially to parents' experiences and needs throughout the child's lifespan. Ensure a non-judgmental, trusting, confidential relationship. This is a tough topic with varied thoughts, feelings, and experiences, as we've talked about. We have to get comfortable with the uncomfortable of grief, loss, and trauma. We have to start where the family is in their journey, to lean in and listen. We need to be self-aware of your role and boundaries, because I hope you don't walk away feeling you need to be a grief counselor. We do not ask you to be better. We do ask you to be better informed. And if you follow our takeaways above, that is what we consider our appropriate role as we love and care for each other. Referring a family member for counseling may be appropriate, or pointing out the resources that exist. But a reminder that what you, quote, carry on your shoulders needs boundaries. Our self-care is as important as the support you provide others. We can't express enough gratitude to Jen Knox, whose powerful story will bring to light grief over the lifespan. Please help me welcome Jen Knox, parent to Charlie, Holden, Wyatt, and wife to Jason.
Thank you, Jana. Charleston Ella Knox joined our family shortly after her twin brother, Holden. It was a highly anticipated event for everyone in our family, specifically her dad and her older brother, Wyatt, who had just turned 2 years old. Having carried the twins to full term and having a relatively healthy and boring pregnancy, we had nicknamed our twins the Twinnados. I was super excited to meet them. This nickname had proved to be pretty accurate over the next few months as we navigated through some pretty rough waters right off the bat when Charlie failed her newborn hearing screen while still in the hospital. Once we were home, she developed difficulty feeding and keeping her formula down. And that ended up landing her in the children's hospital at a week old with a failure to thrive diagnosis. My husband, Jason, and I had only been married for 3 years, but we had seemed to master the multitasking it would take to ensure our daughter was able to be seen at the multitude of appointments with the audiologist and GI specialists that were referred to us by our amazing healthcare provider, our pediatrician. Jason took on very specific roles. I may have been the captain of the ship, but the boat doesn't get anywhere without a first mate. And that's what Jason was and still is for our family, an amazingly skilled first mate. All I'd have to do is say when and where we needed to be, and he would make sure that we got there. And during every storm we went through, he kept our little boat afloat. By the time that Charlie and her brother were 4 months old, we were navigating that little boat through the uneasy waters of audiology and GI appointments every 2 weeks, and pediatrician visits every 3 days. We never got any more than 2 hours of sleep at a time. We were exhausted. I mean, we had newborn twins and a 2-year-old. Of course, you're going to be exhausted. As I was preparing to return to my full-time job at the end of my maternity leave, I got a call from the University of North Carolina, Chapel Hill, and it was their genetics group. Charlie's newborn screen had been flagged through a pilot program identifying infants with XALD. And could I have her blood taken again and resubmitted for further analysis? Good grief. If I couldn't juggle anything more, newborn twins, a 2-year-old, going back to work, sure, why not add just one more appointment, one more thing to our growing list? And also, what in the world is XALD? How is this going to further impact our family that was already juggling so much? You can imagine I was scared, but talking to Jason, he righted my sails and we got to work. So the next day, as I sat in the audiologist's office waiting to see if the latest hearing test yielded any results, I went on Google and researched XALD and steered our boat right into some deeply confusing and speculative waters, not really knowing what to think. But all I could think about was now I need to figure out the next steps. If this is what's going to happen, I need to figure out what to do. And about that time, the audiologist gave me the news that while the test results were still mostly inconclusive, she believed Charlie had hearing loss in one ear, but she'd need to have a sedated ABR to know for sure. And I managed to hold it together till Charlie and I got home, and then I cried. Music is the way that my soul expresses itself. And how was I going to do this? How was I going to connect with my child who had a hearing impairment if it wasn't going to be through music? And I felt like my whole world was just turned upside down. The XLD and all of that was just a million miles away compared to what we were now dealing with. At Charlie's next pediatrician appointment, I completely broke down with just the fear and the grief just spilling over. And our amazing pediatrician, who'd already been our hero through everything she did to help with the feeding issues and the hearing issues, referred us to the CDSA. The CDSA is the Child Development Services Agency of North Carolina. So there was no time to waste. We adjusted our sails, and we added to our crew a speech therapist, physical therapist, all in addition to the GI and audiologist. And our little boat was starting to get pretty crowded. When Charlie was 8 months old, we got the call from UNC Genetics that the results of her further testing were in. That day, I was working from home, and in between phone calls, Jason was getting ready for his weekend of night shifts, and I had about 20 minutes to spare. So I called the geneticist and was really looking forward to learning what was going to happen to our family, hoping, of course, that it was nothing. And looking back, this was the day that our lives really, as I had reimagined it, came crashing down all around me like a Category 5 hurricane. I'll never forget the geneticist's words. Good news, Charlie doesn't have XALD. Thank goodness. Bad news, she has Zellweger syndrome. And based on how she presents, she's likely on the severe end. What? Excuse me? What does that mean? Well, she'll be lucky to see 12 months. What are our next steps? Just love her while you have her. What does that mean? Do we follow up with someone? Is there, a specialist that we should be seeing? Is there some sort of treatment we should be talking to someone about? Unfortunately, there's no treatment except for treating the symptoms as they present. What does that mean? How is that even possible? I'm sorry. Your pediatrician will refer you to the providers that can best manage her symptoms and refer you to palliative care and then to hospice when that time comes. Any questions? Yes. I have a ton of questions and I don't understand. I don't even know what that means. What am I supposed to do with that? I don't even understand what you're talking about. But she had no answers. And when we hung up and I ended the call, Jason walked past my office, and seeing the look on my face, he asked what happened. And I choked out what I had been told. He asked me if I wanted him to stay home from work. And I said, why? No, why? So you can sit here and watch me cry all night? It never even occurred to me that my first mate, my husband of 3 years, and my friend of almost 20 years might need or want to stay home from work so he could process his grief. I was firmly holding on to the steering wheel of our boat, headed straight for the hurricane, and all I could see was black swirling clouds and my grief, mine, not anyone else's. I was shocked and rocked to my core, and I was numb, and I was hysterical. To quote a famous movie that still gives me nightmares, we were going to need a bigger boat. So what did I do all weekend? I cried, I Googled, I cried, I read, I cried, I Googled. I watched my perfectly wonderfully healthy boys play and giggle and wiggle around and all the things my daughter would never do. And I grieved really hard. We waited weeks to tell our families and friends because my parents were traveling, and that's just not the thing you tell someone when they're not home. And each time we righted our sails, and tell someone else, and we just watched them crumble every time. We had to comfort our family and friends. Obviously, we would. Every time we told them the news. And everybody had so many questions, and we still had so many questions. You know, same things. What do we do? How do we treat this? There is no treatment. Who do you see? There is no one to see. What happens if she gets a cold? And do we keep our oldest child in preschool still? What if he comes home with a cold and gives it to his sister? What would that do to our family? Do we even bother continuing to see the audiologist and speech therapist and the physical therapist? What benefit are these appointments even going to give us at this point in time, really? How are we going to tell people how we're moving forward when we really still know absolutely nothing? We felt like our little boat was just completely set adrift with no way to navigate, no idea where we were going. Every time we got our sails into the wind and told someone else, the grief would come back. The hurricane, we would just steer right back into that hurricane. And I felt like I was drowning. Jason would go to work fixing things, but I was drowning. But I'm a strong swimmer. I felt like I was failing, but I'm smart. I can figure this out. I love my child. I love my children. I can figure this out. I'm a hard worker. I'm smart. I'm a strong swimmer. I can do this. So for the next month, we were caught in this cycle of coming to terms just to end up back in the hurricane again. And then we were told during a routine eye appointment that Charlie was blind. She had cortical vision impairment. I didn't even see that storm coming. As I sat in my car, pulled over on the side of the road, I cried hysterically. So my baby girl is going to die soon, and she's going to do it blind and with limited hearing. What do I do now? How do I even figure this out? It was just all too much. I can't do this. I don't know how to do this. Nope. I can do this. Make a plan. Move forward. Keep the wind in your sails. Move forward. Make a plan. Adjust the sails. Research more. Move forward. Keep moving. After a month went by, UNC Genetics gave me another call. There's a doctor that recently joined the practice, and she has experience with Zellwegers. Do you want to see her? Yeah, of course we do. Having Dr. Smith in our lives was like the sunshine after the storm. She was bringing us into calmer waters. She smoothed over our tattered sails. She propped up my deflated confidence and gave us scenarios, things to look for, things we could do now to prepare us for Charlie's needs in the future. She validated my insane need to document everything. And when medical providers dropped Charlie because of her complex diagnosis, Dr. Smith found us new providers, and she took it a step further and she collaborated with them all. Finally, it seemed like our growing crew was working together to help us get to a better destination or a better handle on what our journey was going to be. And eventually really help us get to our destination, even if the destination was something that we rarely talked about. Milestones came and went for Charlie's brothers, and we celebrated and grieved each time. Questions continued to swirl around us. Simple things like holidays. Would they be our onlys with Charlie? How many celebrations would we get with her? As we neared her 1-year birthday, a day we were told we would never see, I tried to focus on every day that we had with her. And we would make use and meaning of all the extra time that we would get. Jason always knew how to focus on the love. And it was harder for me, but as we settled into our unroutine, lots of things that we wanted to do started to fall into lists and buckets, and it felt really good. The prospect of hope in a future uncertain, I guess, a normal, even if it was completely unnormal. During one of my many Google searches that had become routine, I stumbled on an article about a little girl with Zellweger's. It was an older article, but it referenced the Global Foundation for Peroxisomal Disorders, and I immediately went to their website and then to their Facebook, and here were my people. This was another turning point for me personally. It wasn't like having calm waters and sails full of wind. This was like having our boat upgraded and modernized. We were invited by the GFPD to attend their 2019 conference in Washington, D.C., and I cannot count all of the ways it changed our lives. There were others like our baby girl, and they were of all types of ages and spectrums of abilities. And we had parents just like us, and we got to hear stories, the good and the bad. And we learned to make plans, the happy and the final. And it was all okay. We never felt judged or morbid for talking about end of life plans, which would be something that became very important for us. We were literally surrounded by parents and families that got it. We felt prepared and validated when we left the GFPD conference, and honestly, more hopeful than we had ever before. Within a week of returning from the conference, Charlie stopped breathing, and we took our first ambulance ride of many, which resulted in our first extended hospital stay of many. And Charlie was developing seizures and difficulty maintaining her oxygen levels. This brought us into a whole new storm, or really a whole new string of storms that found me battling and advocating for EEGs, documentation, seizure meds, everything that we could do to get Charlie on Medicaid so that she could get access to equipment and assistance that would really be life-changing and what she really needed now. And while that battle raged in the background, life continued on. We celebrated more holidays. We celebrated second birthdays for the twins. Charlie had officially lived twice as long as anyone expected. And my life was lived by her needs and documenting it all along the way. How much she ate and when, medicines and dosages and changes, and the effects of those changes, what she liked and didn't like, seizures, diaper outcomes, you name it, it went in the log. And after 3 declinations, 2 appeals, and almost a year of advocating the state of North Carolina, it finally happened. We were finally approved for Medicaid. And I thought it would all change immediately, but help would not come right away. My happiness was pretty short-lived. It would take 4 months after being approved for us to finally get the help that we needed. And while we were excited to join, to get the assistance we needed with the nurses and all of that, we knew that it meant we were ultimately closer to our destination with Charlie, and it had become a bigger reality for us. And we really had to start making clearer decisions. Medicaid may have given us more crew in our boat, but it meant we were closer to the end. And while I held tight to that steering wheel of our ship, focusing on therapies, medicines, herbal interventions, documentation, Jason made sure our ship was seaworthy and that we didn't forget to just love our family. I always felt like I was in two places at once. Every happy moment celebrated had me wondering if it was the last. I watched the GFPD website for new research, parents doing new and interesting things to stimulate their children's environment. But along with that also came strange grief as I fretted and stressed over the hospital stays over their children. And their children's health declined, and would find myself grieving hard for the loss of babies that I had never met, but were just like my little girl. Even new members made me grieve. I knew the fear they were feeling, and I didn't want them to feel set adrift like we had. Just as we were looking forward, COVID hit, and while the world reeled in its new storm, these were waters that we were already used to navigating. We were familiar with hand sanitizers, not going in public much, face masks, fear. But we finally added the new crew member, the long-awaited and highly anticipated addition, a CNA. His name is Edio, and he was amazing. He learned our baby girl and gave our family the amazing opportunity to be a family by lifting some of the weight we carried, by caring and loving for our girl so well. Soon as they do, the tides began to turn. There were more frequent seizures and medicines, and after 2 months, Charlie needed 24/7 nursing care, and we had to say goodbye to Edio, and we added 4 nurses to our crew. The good was we finally slept more than 4 hours, and I started having less panic attacks when I thought I'd forgotten something, and there were just more people to love on her and care for her. Jason and I knew we were nearing the end of our destination, and serious conversations became a reality. And we had to make some plans. And in true form, I wanted documentation. I wanted a plan A, a plan B, a plan C, and D. And Jason was patient. He did most, if not all, of the legwork, but most importantly, he kept my hands steady. He would ask the right questions and validate my feelings that when Charlie was ready to go, it was the right time, even if we weren't ready. And even if our instinct was to fight, we were committed to following her lead and her needs. But we had a few conditions. She was going to be surrounded by love. And if she had to go, she was going to go with her brothers tickling her toes, her favorite smells, and her family. She would be surrounded with her mom and dad and our sweet, loving, faithful dog. And she would never know the storm swirling around her. Two days before Christmas of 2020, the hospice joined our crew, and our ship was made ready for the storm. And on January 12th, 2021, we watched our daughter take her last breath after blessing us with 1,093 days, just 4 days shy of her 3rd birthday. She had been ready, and we knew it, but I was not. We knew what was going to happen for 2 years. She was in hospice for 2 weeks, but that doesn't stop the grief. If anything, it silenced all the thunder and lightning, like I myself had just become shell-shocked, immune to the effects of the storm in general. And I stood silently amongst great devastation. My world was shattered. I had made plans, but I still didn't know what to do. I didn't even know how to breathe, and I really didn't even want to. I was standing on the deck of our ship, arrived at our destination. A climax to all that we knew to expect. And it was a mess, and I was a mess, and nothing was okay. But I didn't want anyone to touch anything. Don't help me. Don't try to fix it. This is my mess, my shattered world. Don't touch anything. I can fix it and clean it up when I want. And I will when I'm ready. I had so many new questions. What did I do now? What do I do now? I had lived and breathed keeping my child alive, even when I knew ultimately she wouldn't live. What do I do with all of that energy and a lifetime of love that I'll never get to give her? And worse yet, if I step off this ship, how do I decide to react to those around me? I found that people really want to be supportive. But the words that comforted me one day didn't comfort me the next. Words that comforted others did not comfort me. But they were there, and they were trying. Since I didn't know what to do with myself, after my designated 1-week bereavement leave from work, I decided to go all in on finding my new normal. So I went back to work. Jason went back to work. I allowed myself to go on autopilot. When in doubt, work. Keep moving forward. Don't look back. The mess is still there. You'll get to it later. It was hard sometimes because I wanted Jason to show his grief like me. And inside, I'd get frustrated sometimes, but I stopped. Jason isn't me and I'm not him. Jason's grief is his own and is different from mine. And he allowed me to grieve as I needed to, and I should do the same. All we needed to do was support each other and allow each other the room to grieve. And if that meant that Jason needed to tile the backsplash in our laundry room or turn his basement into a man cave, so be it. And I would turn to the GFPD family, and they would give me the opportunity to co-facilitate one of the family-to-family committees that had become so integral to my own mental health the last few years. Now, present state. Our ship is still docked in the harbor. We don't have a large crew anymore. We're making repairs and trying to figure out how we move forward as a family, and I'm looking at my mess still, and someday I'll clean it up, but not yet. I'm finding meaning in some new ways. I'm a strong advocate for my boys. Holden's memories of his sister are less complicated than Wyatt's because he was so much younger, and Wyatt took a lot of pride in helping to take care of Charlie. There are times I have to advocate strongly with his teacher for him to have the space and grace to grieve. And that can be hard for a kindergarten teacher to understand. I mean, really, how many 6-year-olds have lost a sibling? So I listen to his questions and try to answer, but I'm also honest when I don't have answers. And I'm better now at choosing who gets to hear my story and why, and when, and how vulnerable I choose to be. The old me would have swept it under a rug, pretended like it didn't happen, nothing hurt. But I won't do that now, and I won't allow my boys to believe that they aren't tough just because they grieve. In our family, we won't sweep it under the rug just to make things go back to other people's notions of normal. When I was preparing the story of my grief, I remembered something that I had told Jason, and I really believe it's helped me find meaning. When Charlie was born, before everything changed, I had so many hopes and dreams for her, as we all do as parents, but I distinctly remember thinking that it all boiled down to one very important wish that I had for her. All I really wanted was for her to be a positive member of her community, and I'll be danged she was. She's taken part in many scientific studies, medical and pharmaceutical trials. She was a donor for the University of Maryland Brain and Tissue Bank, and every hospital visit or extended stay saw her being visited by interns and doctors that wanted to learn from her. And remember that CNA, Edio? He's currently in nursing school and has become a member of our family and the GFPD family. as he volunteered this year at Warrior Camp. My daughter may not have had the chance to set the world on fire like I thought she was when I was pregnant, but she certainly was a spark, and she lit a few fires, and who knows what those fires might turn into. Thank you.
Jennifer, thank you so much. On behalf of Megan, Jen, and myself, we want to circle back to what we know. Our family's love for their child and the impact their child makes in their lives creates a better world. We just want to acknowledge their lifespan of grief to continue to strengthen the family's ability to lead. And we so appreciate your desire to learn and take the risk to be a part of this conversation. At this point, we're happy to answer questions, acknowledge you, or just give you a virtual hug. And please know you can reach out to the GFPD if you want to talk to either Jen, Megan, myself, or Katie. Thank you so much for listening.
And just as a reminder, we do have a box below for Q&A where you can submit anonymously. And we also have the chat box. If anyone had any questions or comments, you can go to either of those places. I do have one quick one. It's from an extended family member. So Jana, I don't know if you want to address this, but obviously any of the panelists, Jennifer, Megan, if you want to chime in. One from the extended family member asked about supporting adult loved ones while the child is living.
Yeah, so this is Jana speaking, and it's an ongoing challenge. I'm so glad that you asked the question. And the answer is always, it varies with the needs of your family and the type of relationship that you have. But the best thing that we can guide you on in that is what we had mentioned before, is to be there, be present, and be listening. And we also have an extended family group that is is a part of helping support extended family, because the pain is still there for extended family, just like it is, different, but the pain is there with the child that's not only died, but also the adult loved one. And, so great question. It does depend, but your presence is really going to help and be there to listen.
Thank you, Jana. And I think just because they asked that question, maybe we could address, the same, but when, after the child has died, how do we best support these adult loved ones?
This is Jana speaking. I think it's actually trying to have conversations about whatever, in order to have the same trust that you have with your family members, to have them feel safe enough to explain how tough life is right now. But I'd walk the walk with them.
And I think that I would probably add, as somebody that's been through this, but also somebody that has a pretty hefty sense of humor. Sometimes the sense of humor, you may not get it. And I think that just not being judgmental, and if they've made a joke that you don't necessarily think is funny, humor them anyway. Don't admonish them. Don't make them feel as though their feelings and their humor is invalid, because if that's how they're dealing with it in that moment, that's how they're dealing with it in that moment. And I think that if you may not understand it, and that's okay, but just don't make them feel like they are wrong and that they can't grieve the way they need to be, just because you may not feel like it's appropriate, if that makes sense.
Jen, this is Megan. I would add to it, for all the families that we've provided support to thus far through their grief, this is my Megan Cody statistic, not a really formal qualitative statistic, but 100% of them. I haven't met a family yet that hasn't, the big bulk of it is just giving the family permission to speak about their kid and keep them in their present. So by you modeling that you're still thinking about and remembering their child, it gives the parents and the family members of the loved one who has died permission to talk about them without making you feel uncomfortable as the person that's supporting the individual who's really grieving intently because they're the parent or they're the sibling or whatever their role is. Because people don't want their child to be forgotten, right? And so by you keeping them in your present as somebody that's supporting them, you're giving them permission to talk about them as well.
Thank you, all of you, for that. I do have so many compliments, Jennifer, for your beautifully spoken story, as some of the words that have been shared through the Q&A. Such amazing strength. I couldn't agree with them more. Thank you for being vulnerable and sharing. We do have a question directly for you, Jennifer, about how did you decide that it was time for hospice?
That's a really tough, a great question. I think physically there were a lot of different things that, as I look back on it, it made it very obvious. Charlie was 100% dependent on oxygen. And while that may be the case for a lot of children, she was requiring more and more oxygen to keep her levels up. So there were physical markers, and her seizures were getting really bad. The medicines, weren't necessarily helping. She wasn't recovering from her seizures, as well. So that's all kind of in hindsight, I saw those things. But truly in the moment, we had amazing nurses, but one of the nurses was also a hospice nurse. And funny enough, her name was Eva. She was Polish. And she, in a very, European, loving, blunt way, was just honest with me and said, it's time for you to call in hospice. And I had originally said I didn't want to because we thought we would lose our wonderful nurses. And she said, no, that's changed. It's not like that anymore. And so, she really pushed me to really consider it. We called, we had a couple options for hospice for children, and we called one in particular, and they were just so wonderful. They came out that day. And in hindsight, I will say I wish that we would have engaged them a little bit earlier, because they were able to really get some things done that if we had had more time, it would have been really nice to have had those opportunities. So like I said, in hindsight, it seemed clear, but we were lucky that we had someone that really pushed us to make that decision.
Thank you so much for being willing to answer and share that with all of us. I just want to give it one quick moment more. I know we're running a little over, but this is such an important topic, and we so appreciate you, Jen. There's more comments coming in. Just really grateful for you sharing your story today, and just your willingness to put into words what so many have experienced.
I'm happy to be here, to be honest.
And I thank you all, Jana, Megan, Jennifer, so much for being here today. To our audience, thank you for participating. We ask that you please complete a survey that you will be receiving in your email that you registered with for this event. And we're going to go ahead and finish up. We hope you all have a wonderful day. And if you need to reach out to anybody who presented again today, please reach out to the GFPD. You can reach out to me or even our Contact Us button on our website. And we'll make sure to connect you with Jana or Megan if you have follow-up questions. Thank you.